Hello student, welcome to my channel. Today we discuss ESIC previous question paper 2019 part 1. ये है आज का हमारा पहला क्वेश्चन. The test that is most specific for myocardial damage is option A myoglobin, option B CKMB, option D troponin I, option D creatinine kinase, and the correct answer is option C troponin I. Next question number 2. The term MRSA in bacteriology stands for option A multi-drug resistant Staphylococcus aureus, option B methicillin resistant Staphylococcus angiosus, option C methicillin resistant Staphylococcus aureus, option D methicillin reactive Staphylococcus aureus, and the correct answer is option C. Next question number 3. If palpating the tragus or auricle causes pain, the problem is option A sinusitis, option B pharyngitis, option C ositis media, option D ositis externa, and the correct answer is option D ositis externa. Next question number 4. Which of the below does not help in controlling hazards in a school? Option A food supply to the student should be safe, option B the school should be built near from the source of noise, option C the school should be well ventilated, option D health education should be included in the curriculum, and the correct answer is option B the school should be built near from the source of noise. Next question number 5. Which of the following is not a component of HELLP syndrome? Option A hemolysis, option B low platelet count, option C elevated liver enzymes, option D bleeding per vagina, and the correct answer is option D bleeding per vagina. Next question number 6. Introduction of solid foods along with breastfeeding is called option A schedule feeding, option B complementary feeding, option C conditional feeding, option D demand feeding, and the correct answer is option B complementary feeding. Next question number 7. Which of the below is the true statement about the age zone of the sarcomere? Option A it is devoid of thick or thin filaments, option B it contains thick and thin filaments lying side by side, option C it contains thick filaments only, option D it contains thin filaments only, and the correct answer is option C it contains thick filaments only. Next question number 8. The anterior fontanelle closed by option A at birth, option B 2 months of age, option C 2 to 3 years of age, option D 9 to 18 months of age, and the correct answer is option D 9 to 18 months of age. Next question number 9. When performing suctioning on a patient, you should option A Apply suction continuously while inserting the catheter. Option B. Apply suction intermittently as the catheter inserted. Option C. Perform suction on the patient for longer than 10 seconds each time. Option D. Oxygenate the patient's lungs before and after suctioning procedure. And the correct answer is option D. Oxygenate the patient lungs before and after suctioning procedure. Next, question number 10. Test used for the diagnosis of trichomoniasis is option A. Weight amount of vaginal fluid. Option B. Ova and parasite fecal smear. Option C. Specific serologic test. Option D. Enzyme linked immunoassay test of serum. And the correct answer is option A. Weight amount of vaginal fluid. Next, question number 11. The advantage of using a three-part diagnostic statement such a problem, etiology, sign and symptoms format is option A. It improves communication between physician and nurse. Option B. It helps the nurse in delegating. Option C. It standardizes organization of client data. Option D. It decreases the cost of healthcare. And the correct answer is option C. It standardizes organization of client data. Next, question number 12. The most common cause of retinal detachment is option A. Diabetes mellitus. Option B. Brain tumors. Option C. Trauma. Option D. Degenerative changes in the retina. And the correct answer is option D. Degenerative changes in the retina. Next, question number 13. Positive Brzezinski and Karnik sign are indicative of option A. Hemiplegia. Option B. Peripheral neuropathy. Option C. Alcohol intoxication. D. Meningitis. And the correct answer is option D. Meningitis. Next, question number 14. Scalp typhus caused by, and the correct answer is option D. Next, question number 15. Voluntary rejection of unacceptable thoughts and feelings from conscious awareness is called option A. Suppression. Option B. Sublimation. Option C. Substitution. Option D. Symbolization. And the correct answer is option A. Suppression. Next, question number 16. Mode of inheritance of cystic fibrosis is option A. Autosomal dominant. Option B. X-linked disease. Option C. Autosomal recessive. Option D. Non-Mendelian. And the correct answer is option C. Autosomal recessive. Next, question number 17. Lactational amenorrhea acts as a contraceptive method by option A. Preventing sperm entry. Option B. Spermicidal action. Option C. Preventing implantation. Option D. Preventing ovulation. And the correct answer is option D. Preventing ovulation. Next, question number 18. Which of the following is a confirmed indication of pregnancy? Option A. Amenorrhea. Option B. Fetal heart in ultrasonogram. Option C, beta ECG in urine. Option D, vomiting and nausea. And the correct answer is option B, fetal heart in ultrasonogram. Next, question number 19. Nagel's rules is used to calculate. Option A, cervical dilation. Option B, gestational age. Option C, amniotic fluid. Option D, expected date of delivery. And the correct answer is option D, expected date of delivery. Next, question number 20. Multiple sclerosis is characterized by option A, impaired cerebral circulation. Option B, deficiency of the neurotransmitter dopamine. Option C, deterioration of the spinal column. Option D, progressive demyelination in the central nervous system. And the correct answer is option D, progressive demyelination in the central nervous system. Next, question number 21. The genera that needs pyridoxal for growth is, and the correct answer is option A. Next, question number 22. Which of the following is not a function of the fibrous skeleton of the heart? Option A, acts as a point of insertion of cardiac muscle fibers. Option B, conduct the impulses from artery to ventricles. Option C, form a structural foundation from the heart valves. Option D, prevents overstretching of the valves. And the correct answer is option B, conducts the impulses from artery to ventricles. Next, question number 23. The diagnostic statement excess fluid volume related to decreased venous return as manifested by lower extremity edema. The etiology of the problem is option A, idiopathic. Option B, edema. Option C, excess fluid volume. Option D, decreased venous return. And the correct answer is option D, decreased venous return. Next, question number 24. Intermittent claudication is a sign of option A, arterial occlusive disease. Option B, myocardial infarction. Option C, nerve injury. Option D, peripheral neuropathy. And the correct answer is option A, arterial occlusive disease. Next, question number 25. Pepsinogen is the stomach is secreted by option A, Chief cells. Option B, goblet cells. Option C, G cells. Option D, parietal cells. Thanks for watching my video. Please like, share and subscribe my channel.